We have to go to Kumasi in the Ashanti region, where fire personnel have been battling a huge late-night inferno that spread through the Kumasi Central Market. We have on the line Erastus Asaridonko, and early on had reported that the fire started around 9 p.m. Wednesday at the section of the market called Bode. I hope I pronounced the name right. And Erastus is on the line. But Erastus, how severe so far has been the inferno?
I must say that this has been described even by the fire personnel as the biggest of all the fires that has ravaged this particular market for years. In fact, this might be the fifth time this fire has come under this intense inferno. I must say that it's from where I'm standing and from what I can see through the smoke and the flames that is currently being battled by the firemen, I could count close to 200 shops. In fact, all razed to the ground. Now, this area is what they call the Adishia Lane. It houses the shea butter sellers. It houses the groundnut sellers. We have the coconut sellers as well here. We have those who sell bush meat in this particular area. Now, what is making this fire so difficult to fight, according to the fire personnel, is that the harmattan has made the structures in here very dry. And then we have combustible materials like the shea butter. We have oils in bottles. We have gas cylinders placed in people's shops. A whole lot of materials that burn easily. And so even when they've been trying to battle this for the past 5 hours since it started, and they are now trying to put out the dying embers. Where I'm standing is all smoke and flames in some sections, and people are being prevented from coming in because it's a dead zone area, I must say.
But that brings into sharp focus what really the measures were prior to now, as far as making sure we prevent some of these incidences.
Well, authorities have closed an eye on this particular market concerning putting in some restrictions or measures or precautions, for example, trying to contain or prevent future fires, because the excuse that has been given time and time and again is that they are redeveloping the market itself. They are engaging in the redevelopment project just a few meters from here with a Brazilian loan. And so that will take care of all these problems. And so if we ask me, there has not been any measures, any precaution whatsoever. Various fire investigations and their findings are falling on deaf ears. They are sitting in the books. Nothing has been done. And so the haphazard wiring and people cooking in the market and all that is still there, and that is what is causing this fire again.
Well, we'll see how that goes. Have anybody been able to salvage their wares, especially those traders who mostly have been affected?
Roland, they've been doing that since the fire started. In fact, sometimes I must say, in very dangerous parameters they've been going. They were working alongside the fire personnel. In fact, I must say that the fire personnel, a combined team, they've been working so hard for the past 5 hours trying to bring this fire under control. Many of them are very exhausted at this particular moment, but they keep on fighting. Now, the traders have been coming in their numbers, and many of them have been able to salvage their wares, some of their wares. One particular store, they started bringing out items. They were able to salvage half of the items in the store, and then the fire came in. They couldn't get closer anymore. They had to abandon them, the rest for it to burn. So that is what has been going on. People have been going in, picking out items. Even as I speak, this place has been declared unsafe for people to tread. but you can still see some traders coming in here trying to salvage what they can from their shops.
But before I let you go, though, you mentioned how hard the fire personnel and indeed the other complementary service personnel have been working to improve the current situation of perhaps battling the fire. But I get the sense that they've been having a rough time. Is that the case?
They've been having a very rough time. I must say, getting even their water hose through the really congested market is a problem. I've been here with them since the fire broke, and I must say they had to use one fire tender. They had two fire tenders, but they have to use one as a support. They have to pump one one of them, and to be able to get through, because the other fire tender cannot find its way really into the market. And so that's how it's been. They've been pulling their hoses through, meandering through holes and all that, trying to break through certain areas before they can get to the fire. And that is what has caused it to spread further as well.
We'll see how that goes, and we'll get back to you, I'm sure, within the next hour for you to give us the latest update as far as this is concerned. And Erastus Asaridonko is with our sister station, Love FM, bringing to us the latest report about an inferno that's been reported in Kumasi Central Market, in which at least one or two other lanes and affecting several traders, resulting in loss of their wares and property. Well, I'll bring you the latest updates as far as that is. But let's get on to other mainstream news, because we know currently there's been the implementation of the energy levy law. And as a result of that, well, commercial drivers at the Kwame Nkrumah Circle, Accra's most important transport hub, are getting ready to relocate following a directive by the Urban Roads Department. And the relocation is also to allow contractors working on the interchange a free hand to go about their work. The drivers are yet to know where they would be relocated, but are also hopeful that information will be made available when they have their final meeting with officials of the Department of Urban Roads. Derek Akosam has been speaking to the drivers and some of the traders.
For 3 decades, they've been plying their trade here. This is where they earn some money to take care of their families. But it appears they may have to say goodbye, albeit for a short time. As the construction work goes on, the Department of Urban Roads would want to relocate the drivers here to a different place. But how will this affect them? Let's talk to some of them. Now, I understand that you will be relocated. How true is this?
It's true that we are going to be relocated, but we are going to have the final meeting with the Urban Roads on tomorrow, 11 o'clock. That will determine our fate.
I hear the relocation has to do with the construction work going on. Is it true?
Yeah, it's true.
So if you are relocated, do you have an idea as to where you would go to?
Unless we have the final meeting with the Urban Roads, because right now I can't tell you where we are going now.
What effects will this relocation have on you?
Because it's going to affect us very much, because the passengers coming to board our cars will be stranded over here. But we will be looking for leaving the porters here for them to just the passengers where the stations are, so that when they they will come here. And when they come here, the station is not here, they will be stranded. So the porters will be here directing the passengers and telling them where the stations are.
Before people will get to know where we are relocated, it will take time. That's our problem.
But I hear the relocation is because they want you to have a better station.
Exactly.
You don't think it's a good idea?
Yeah, it's a very good idea, but how passengers will know where we will be standing and load, that's our problem now.
What would you do?
So I think we have to advertise, talk to people. I mean, maybe have some megaphone shouting, hey, we will be leaving to this place at this, so until they finish the project.
When they started this project, they told us very soon they will locate us to a new place, so we are aware of. So getting to the Christmas, they inform us after Christmas they will locate us to a new place, so that they will, level this place, and then later we come back.
The drivers may not be the only people who will be affected when they are relocated, because there are some businesses around here who also get some money from the passengers that pass by. We want to ask them how they would also stay afloat when the drivers are here no more. How will you be affected?
Yeah, that's where we get money to pay fees and stuffs. So we will be affected.
How has business been for you with the drivers around here?
Yeah, business have been good. But since they are starting the work, business have been so bad.
You don't have the passengers coming in to buy?
Yes, because the road have so many years, some people don't pass around here again.
So when the drivers move, would you move with them?
We don't know, but they said the place they have is not enough, so there won't be any container there.
Move from here.
We will park, yes, we will park and go home. If they finish, they will come back.
So I hear that they will be away for almost 6 months. You'll be home.
My mommy told me that it's only 3 months, the between of 2 months and 3 months.
So for all those 3 months, you'll be at home?
Yeah.
How will you get money to get them for the
That's one that I don't know. It's with God.
In as much as they do not like the idea of being relocated, they have to comply with it because they would want a better station to work from. They also say they would look for other means, innovative means, of course, to ensure that even when they leave here and they don't have access to their normal customers, they will still stay afloat. From the Circle Station here in Accra, Derek Ekosam for Joy News.
Oh, we have to turn attention to health. And the Ridge Hospital in Accra has set up a temporary 10-bed ward to deal with severe congestion being experienced at the facility. The hospital saw an influx of patients during the Yuletide, compelling doctors to treat patients on benches at the outpatients department. It is not clear and why the upsurge in the number of patients is being experienced at the hospital. But a senior nursing officer at the facility, Betta Akpabe, says the temporary ward should help ease the current pressure being experienced.
Authorities of Ridge Hospital say patients will no longer have to receive treatment on benches since they have put up contingency measures in place to deal with the recent congestion at the facility. 10 more beds have been added to the existing capacity of 191 beds. The new facility, known as the OPD triage, will specifically handle critical cases to free up space in the outpatients department.
Now, due to the opening of the new triage, we've moved all the emergency cases to the triage. So as you can see, the OPD is now free. The chairs are now free. First, we were nursing about 35 to 40 patients on the benches here. But now, due to the opening of the new triage, the place is free for the patients to use now as OPD. No more bench nursing at the OPD now.
So tell us more about this triage.
This triage basically is a unit that receives emergency cases that are referred to the Ridge Hospital, and as equally unreferred cases that they brought to the Ridge Hospital for us to nurse. So what we normally do is we triage all the cases over there, and if the place is full, we still resuscitate the patient, and then if we realize that you are a bit okay, that we can refer to a nearest facility for further treatment, refer you to the nearest facility.
So when you say triage, when you triage them, what exactly do you mean by that?
It means you sort out patients who are critically ill. Do you understand? As we have a lot of patients here now, you have to sort them out. Those who are critically ill will be attended to first to save life before others follow. Everybody is a patient who is critically ill, but some are critically ill. Their condition needs urgent attention.
The Ridge Hospital is one of the key referral centers in the Greater Accra region.
The Public Utilities and Regulatory Commission, the PURC, has announced new tariff late last year, and they're pegged, of course, 59.2% hike in electricity and some 67.2% for water. A fuel price increase of 27% also came into effect on Monday, January 4, 2016, after the passage of an energy sector levy bill into law by Parliament in December 2015. Well, there's been public outcry over the increases in tariffs and the prices upwards of petroleum products. However, for the management of the Ghana Gas Company, it may be good news after all. Others will ensure that the VRA settles debt owed the company. Corporate Communications Manager of the Ghana Gas Company, Alfred Ogbami, has been speaking to Joy Business.
Yeah, basically, in terms of the debt, the PURC is leading a process to resolve the debt relationship between the utility providers. And of course, we are one of them. We owe GMP, VRA owes us, Gridco owes VRA, ECG owes Gridco, and we have this debt cycle, which has been a major problem. And indeed, even the IPPs are to some extent owed. So there's an arrangement ongoing led by the PURC to see how this can be resolved. They owe us. That's a fact. It's out there. They owe us more than $190 million US. It's a fact that just last week they paid something, which we've used in settling our insurance cover. It's a fact that we're engaged in discussions to resolve these challenges.
So I should think that the current hikes in utility tariffs comes as some good news to you guys.
It may be good news in terms of PRA's ability to pay us. Indirectly, VRA owes us. We are looking for them to settle their debt. And if that would enable them to pay us their debt, hey, hallelujah. Good news.
Some residents of Broohani in the Atani district of the Bonafu region are seeking to evacuate for homes following the outbreak of pneumococcal meningitis in the area. Some community members who have been speaking with Joy News correspondent Nesta Kafui Ajoma say they are scared of the disease and also do not have any other option than to desert their community.
People of Broohani in the Atani district started experiencing symptoms of pneumococcal meningitis a week ago. Initially, only realized the gravity of the situation after a series of deaths. Yahya is a taxi driver in the community who has transported several people with symptoms of the disease to the district hospital at Nsoko. He told Joy News that most people here are scared and want to leave the community.
If you say, let's start here, no, they name say, ABC, and they buy a so. A dark rock, yes, sorry, it means we see Nipamiansa. Yet, you can't say, Bessihua, a dear Beckham, best or Aqua Jumana, yes, Ubio.
We are amazed about the number of people that have died so far. We didn't know what exactly it was when it started. We were burying between 2 to 4 people every day. They often die on their way to the hospital. We are really dying here.
Aude has been cleared of pneumococcal meningitis. However, he lives in fear of contracting the bacteria again.
I started from me dream, and then me hearing, but my hearing was see. And dear, me that's why now my noon now. And I bear 2 days now, and I make a to a draw dust stone, and I may know me.
It started with pains in my head, dry nose and lips. I got some drugs from the pharmacy and became a bit better.
And the honor, now, me come so I am ya. And I measure insurance or and I made a call your clinic. And I
was able to go to the farm the following day. I later realized I was not totally cured, so I went back to the hospital and they attended to me.
Yadiano still, that's what me young. And I made call doctor, and I would transfer me some cotton so. Me cotton so, and I'm with a drama. Me no more do no so.
I discharge yellowish flames anytime I cough.
Now I had to say yellow. Me go one yellow.
Meanwhile, the Atani District Director of Health Services, Dr. Michael Roxon, has assured the community that the disease control officers are taking charge of the situation, adding there was no need to panic. He explained that the density of homes in the community could have triggered the outbreak. He advised residents to avoid crowded areas to prevent further spread of the disease.
Yes, the disease is transmitted through the air, it's airborne. But depends on what they are going to do. Those who are going to take samples from contacts went to nose masks, definitely those are going to be so close to the patient that are taking the sample from. Yes, they go with the nose mask. But the other field workers doing the education and other things are not wearing anything like a mask. Because many factors contribute to somebody contracting the pneumococcal meningitis. The bacteria, it's a normal flower for some people, in that some people are carriers. And when the bacteria jump onto somebody who is susceptible, and with the other factors being prevalent, then you can develop the infection. So it's not 100% that if you come to contact with the bacteria, you also develop the disease.
The Adabraka police on Tuesday stormed the Ashanti regional capital in Kumasi in a raid that resulted in the arrest of 2 businessmen for selling fake multi-TV digiboxes. The 2 currently in the custody of the Adabraka police were arrested on December 2015 when they tried selling one of the fake boxes to a police officer. Speaking to Joy News, Chief Operations Officer for Syndicated Capital, one of the accredited distributors of multi-TV digiboxes, warned other fake dealers that they could be next to face the full rigors of the law.
The police department did a lot of work. In fact, it's taken us a long time. Before you can't just get up and decide you are going to raid. We needed to, 1, have evidence of the persons who are involved. 2, you need to also have them in the act, catch them in the act, so that the deniability will not be an issue. And also,
were they caught in the act?
Yes, they were caught actually passing off the fake box as an original box. They issued receipts. And also, most importantly, there are further works going on to actually determine the importer, because I can bet that I can put my 2 cents on it that whoever probably managed to sneak it into the country without going through the proper authorities, because accredited box will require that there is accreditation and licensing from NCA, and all of these do not happen. That's why they managed to penetrate and have it probably at a cheaper price on the market. And that's why we are sanitizing the system. You know, the fact that we trained a person and accredited a person does not mean left to his own 4 corners, he will actually go on and follow the rules and regulations. So we have stepped up the number of monitoring, actually visiting them, you know, spying on them, if you want to call it, to make sure that they actually, one, passing on the right products to the end user, they're actually also providing the end user the right information.
So for the benefit of our viewers, you tell us who these guys are and how they were arrested.
They are arrested in their shops. They are arrested in their shops in the middle. In fact, they actually sold the product to the police detective, unbeknownst to them.
Where and when was that?
This happened 31st December in Kumasi, Edum. And I want to use the opportunity to caution all the other unfortunate dealers and installers who are in this trade of passing off unaccredited boxes to the end user, that please beware. You know, we are looking at you. You know, there's a task force on the ground they are not coming as police people, and that they are in their usual cloth, but they are monitoring to make sure that this goes well. You understand? Multi-TV is a good brand. We've worked very hard that we won't leave it for people, the few bad people, so to speak, to destroy it. So this trade employs over 7,000 people. So there's a lot at stake here.
How would one differentiate between a genuine box and a fake one?
Well, we continue to provide education to the end user about the genuine box. That, you know, besides its branded multi-TV, there's an accredited stamp, which so far that has not been replicated by the fake boxes. So if you are going there, please look out for the accredited stamp on the box. And there's a hotline that you can call if you are going to buy it from any of the shops and say, hey, these are the features of the box. The box, behind the box, it says Syndicated Capital, because we are the accredited people, and the certified stamp is also on the box. And if you are not sure, call 0302 242532, 0302 242532, or 020 441 3484, 020 441 3484. And if the lines are busy, you send us a text or give us a few minutes, because we are handling this for the whole country.
You think these unscrupulous minds can't fake this logo you are talking about that is behind the box?
I think if anything is a clone, it looks just like the original. So they'll continue to try to do this. The thing about it is that as long as we continue to be very vigilant, and we ourselves are not leaving this just to the end user's discretion. We are going out and we are making sure that we are sanitizing the system. And once the sanitization is ongoing, we don't think they will continue to try to do it.
Yeah, but we know where everything is coming from. It was only this is you listen to me.
Just tell me the gospel for that.
The fact is that it was only Christ who died for everybody. Yes. But you cannot die for someone. You carry your own cross. Let someone also carry his own cross. Yes. We know where it is coming from. I'm aware. I know the person's name. I know him very well. Okay. He even called me, but you.
Well, I guess some interrogation captured on camera there. And we'll bring you a lot more. That's it for the news this morning. But next, we'll be looking at what the stories are. They've been summarized on the news portal, majoonline.com. We'll also look at the other news portals, and then we'll bring you the latest updates. And Gladys Oredo will be joining me as we do you those very honest. We're taking a break. We'll be right back.